frequently asked questions on developmental delay. What is developmental delay? Developmental delay occurs when a child does not achieve developmental milestones in comparison to peers of the same age range. There is the implication that development has occurred in the typical order or sequence, but not by the typical time, and that there may be catch-up later. A significant delay is defined as performance that is 2 or more standard deviations below the mean on age-appropriate standardized norm-referenced testing, usually conducted in secondary or tertiary care settings. The delay can be in a single domain, i.e. isolated developmental delay, or more than one domain. A significant delay in 2 or more developmental domains affecting children under the age of 5 years is termed global developmental delay, or GDD. Not all children with developmental delay will have a developmental disability, which refers to severe, lifelong impairment in areas of development that affects learning, self-sufficiency and adaptive skills. Developmental delays can be transient, such as during a phase of prolonged illness, or persistent. What are the other abnormal patterns of development? Other patterns of abnormal development include developmental disorder, developmental arrest and regression, and developmental disability. Developmental disorder or disability refers to a childhood mental or physical impairment or combination of mental and physical impairments that result in substantial functional limitations in major life activities. The implication is that development does not follow the typical pattern or sequence and timing, and that the child may not achieve catch-up with his same-aged peers. Developmental arrest. There is a standstill in developmental progress for a longer period than expected. Developmental regression. There is loss of previously attained skills. This is always a cause for significant concern, and should always be investigated. What factors determine the eventual outcome of developmental delay? These include the cause of the delay, i.e. is it a treatable cause, such as nutritional deficiencies, areas in which the child is delayed, how significant the delay is, the age at which the child commenced an intervention, and the extent of parental and caregiver involvement. If developmental delays are detected late, opportunities for early intervention are lost, resulting in poor outcomes such as learning difficulties, behavior problems, language. What causes developmental delay? Multiple causes or illnesses can contribute to developmental delay. These can be broadly divided into 4 categories: prenatal, perinatal, postnatal, and other causes. How do I identify developmental delay? In primary care settings, children with developmental delays are normally identified through 3 major channels. During routine developmental surveillance or screening, following parental concern, and after third parties such as preschool teachers or nursery care professionals raise concerns. The Child's Health Booklet is a useful resource that should be wisely utilized by parents and clinicians to monitor a child's development. An important step to improve the early identification of developmental delay is educating the parent to make use of the health booklet's developmental checklist. What can the primary care physician do in practice? During each consultation, the primary care physician should encourage the parents to share any concerns they might have about their child's development or behavior, conduct an opportunistic evaluation, i.e. developmental surveillance, and ensure that the child has attended developmental screening at the prescribed touch points. Based on the consultation, a decision can be made to review again, refer further, or discharge. What is the management for mild developmental delay? For children presenting with mild developmental delay, in the absence of any red flags and no abnormality detected on clinical examination, parents can be advised about appropriate stimulation activities and a review conducted in 3 months' time, especially if earlier milestones were achieved. When should a prompt referral be made? In children presenting with significant developmental delays or with a history of regression in development, a prompt referral should be made to a developmental pediatrician. A lower referral threshold is advisable for children who are at high risk for developmental problems, such as preterm children, without follow-up, children with chronic medical conditions, and children in challenging circumstances, e.g. being in the care system or having a main caregiver with mental health problems. What if there is parental denial in cases where delays have been identified? In cases where delays have been identified, but there is parental denial, consider arranging a follow-up appointment to conduct a more detailed developmental assessment. The functional impact of the child's developmental delay should be explained to the parents. When a consultation is pitched at the parental level of understanding, there is a better chance of acceptance. Primary care physicians should follow up with the parents at the next visit to ensure that the referral has been activated. What other support would children with special needs require? Consistent long-term emotional and practical support should be provided to the families of children with special needs. As this group is at higher risk for caregiver stress, consider evaluating stress levels at each opportunistic visit, as well-being has an impact on their capability to look after their children. The family can be referred to a family service center for further support if necessary. What investigations can be done? Head-to-toe examination, including plotting the child's weight, height and occipitofrontal circumference. Hearing assessment if there are concerns about hearing, for example poor response to name when called, and language delay. Vision assessment if the child is not fixing and following, has a history of frequent bumping into objects, or may have delayed fine motor skills. Full blood count, for possible iron deficiency, bone mineral profile and vitamin D levels, if rickets are suggested, thyroid function tests, especially for children with GDD and growth problems, urea levels and electrolyte levels. Take-home messages. Developmental delays are common and can involve either a single domain or multiple domains of the child's functioning. Early identification of developmental delays and appropriate management can positively alter the child's developmental trajectory. Primary care physicians play a pivotal role in early identification of developmental delays through developmental screening and surveillance. For children presenting with mild developmental delays and in the absence of any red flags, appropriate stimulation activities can be suggested, with close monitoring of the child. There should be a low threshold for specialist referral for children at high risk for developmental problems, such as those who are in care, have an underlying chronic medical condition, or have a primary caregiver with a mental health problem.
Audio Jungle. Audio Jungle.